Okay, so I think we are live now. Okay. Hi, everyone. My name is Carlos Acosta, and I am currently IFMSA president and former IFMSA SCORA director. And in base out of our 28th of September campaign, in order to advocate for safe and legal abortion for every single woman worldwide, we're having this webinar and I'm being accompanied today by a very special person for IFMSA and for us. That's called Cecilia Espinoza. So Ceci, would you like to introduce yourself?
Hi everyone. My name is Cecilia Espinoza. As Carlos said, I work for Ipas as a senior advocacy advisor. I'm also the contact person from IFMSA to work with from Ipas and working with IFMSA.
Okay, everyone. So we have prepared a very special webinar today. So I'm going to pull off our presentation for the day for us to get started. Please remember to share your questions by either commenting in this YouTube, like the YouTube channel, or as well in sending them to scoredirector@ifmsa.com, scored@ifmsa.org. And yeah, I don't know, Ceci, are you being able to see my screen or not?
Yes, it's working well. Thank you, Carlos.
Okay, perfect. Okay.
Yeah, and before starting, I just want to thank Carles Pericas, who organized this webinar, and also to Carlos for facilitating the session today, and IFMSA for being an amazing partner for us working together at IPAS. And the reason because we are holding this webinar this week is because last week we had the September 28th campaign that is like the International Safe Abortion Day. And this is a very important day of commemoration because it is a way of calling different communities, the medical students, the healthcare professionals, the advocates, and in the civil society in general to do something to promote a safe abortion and to reduce maternal mortality and morbidity from these issues. So this is the reason why we are having this session, and I will be talking not specifically about the September 28th day, but more about like what is the impact of don't having that the women and girls don't have access to safe abortion even when it's legal in their countries. And I will mention a little bit about the impact that this has on human rights and women's life. So we can go to the next one, please. So something very important to have in mind is the abortion laws around the world. So we know there are only 5 countries that completely criminalize abortion. 4 of these countries are in Latin America and the Caribbean. So we know the Americas is the region with the most restrictive abortion laws: the Dominican Republic, El Salvador, Honduras, Nicaragua, but also Malta and the Holy See are the countries that criminalize abortion completely. And also, but also it's like it is important to note that in the last 2 decades, there has been more than 30 countries that have expanded the condition under which abortion is legal, including Chile, who just like a couple of weeks ago, it was part of this list of countries that completely ban abortion. So we know that there is a movement to change this reality, but there's still a lot of more work that it needs to be done. And even like there's only 5 countries that don't allow abortion, even in cases when women's life is on risk. There are other countries, about 66 of them, that only permit abortion to save women's life. So there is a big number of women that are impacted by this restrictive abortion laws. And we know also that the legal status of abortion is an important indicator of women's ability to enjoy their reproductive rights. And legal restriction often cause high levels of illegal and unsafe abortion. And there's a proven link between unsafe abortion and maternal mortality. So next. So an important thing to have in mind is that people can be in favor or against abortion, but it is important to note that when abortion laws are restricted, they don't stop women from having abortion. They will, if a woman or a girl has decided to don't continue or terminate her pregnancy, they're going to find a clandestine and sometimes unsafe way of terminating these pregnancies. And this is how we can see in this slide from some data from the Guttmacher Institute. In the development world, there's about 6.9 million women that are treated every year for complications from unsafe abortion. So we know that the legal restrictions just endanger women's health. And more than 22,000 women die every year from complications from unsafe abortion. Um, and let's go to the next slide. So at IPAS, we work to promote safe abortion in different ways, or to ensure that women and girls will have access to abortion services that are safe and by trained providers. But one of the recent projects that we had done as an organization is do more research about um, how the abortion laws that are restricted impact women's life. And we did this to improve our understanding of like abortion law enforcement, and but also to have more information that can contribute to the global movement for legalization, so women can have access to it. So we have a study the criminalization of abortion in countries like Argentina, Bolivia, Brazil, Malawi, Nigeria, Rwanda, and others. But what we have done in these cases has been like documenting what happened to women, their family members, providers, pharmacists that have been reported, they have been charged, arrested, detained, or that have suffered any other like penalties for abortion-related crimes. And this research that has been conducted in different countries um, have helped us to understand the impact of the criminal laws, but also this research was done like using different methodology, using quantitative data, especially using statistics from police archives and judicial cases, and also different media articles where they report on like cases of women or providers that have been imprisoned because of abortion. But also we have been able to obtain medical records, in-depth interviews with women, and also with their relatives and other state agents or police that have been involved in these cases. This has allowed obviously to have very important information on the impact that the decriminalization have on women and their families and providers. So let's go to the next slide. So I'm going to briefly present some of the findings that we have from this research project. And obviously, if you are interested on having more information about the cases or about the different the different things that are related to this research, we can obviously share links to these reports. But in general, what we found is that abortion is highly restricted, even in countries where there are different situations where abortion is allowed. It is still very restricted, and women won't necessarily have access to the services, even if it is legally it's illegal in the country. So what happened is that women prefer sometimes like to have services outside of the public health services that are available, or even private services, because there's an environment that don't support them to have these abortion services. Also, we have found that like the criminal laws enforced in various degrees, so it's not necessarily apply in the same way. It's also um, it's like it's there's not necessarily to apply the law, but also to control women's reproductive autonomy, and also to reproduce social stigma around abortion. The women criminalization, it's rare comparing to the high numbers of induced abortion. You know, as we were mentioned in earlier in this presentation, there are about 6.9 million women that are treated every year from complications of unsafe abortion. But obviously, the numbers of women criminalized is very rare. But the fear is always there. So this is why the majority of the cases, the women were investigated after being reported by hospital staff. Hospital staff from different levels, it's not necessarily only doctors, but also nurses or social workers and other people involved in healthcare. And what happened is that even if it is a right of women to receive this emergency care, there's a lot of fear from the staff of being linked to this case and also being in prison or detained because of this situation. And so there sometimes it's like they force women to confess crimes in exchange of like the precedent suspension. So there are situations where women's rights are violated, and there's a discriminatory application of abortion laws, and disproportionately impact like certain groups of women. So we, from this investigation, we have find out like it's mostly like young women, or indigenous, or women with low literacy or living in rural or poor urban areas, that they don't have a lot access to a lot of information, but are also suffer a disproportional impact on how these laws are applied. So next slide. Um, Also, some of the finding is like the penalties goes from fines to prison sentences for up to 15 years. But there are some countries like El Salvador where women have been sentenced to 30 years for illegal abortion, and in some cases. There have been even women who have had miscarriages, and they have been they have go to public services trying to get post-abortion care, but they have been accused of illegal abortion. So um, they also, as I mentioned earlier, like one of the sources of information for this research have been newspaper reports, and something that we find is like between 2006 and 2014 there has been a illegal women arrested for illegal abortion in at least 30 countries. So we know that there's this happening in different regions and different countries, even when we only have like 5 countries that totally criminalize abortion. So and we know, as I mentioned before, it's like it is disproportionately affecting like vulnerable women and girls. Next slide. So there some also other of the finding is like because women fear the prosecution for unsafe abortion, they often delay or fail to seek treatment, having these adverse effects on their health and their life. And this is, as I mentioned before, it's like some of the healthcare workers or staff may refuse to provide services because they also fear persecution or the removal of their medical license for treating women um, that have had an illegal abortion. So um, in this situation, the fear of criminal persecution It also like it limit providers to protect women's health and rights. And the criminal abortion laws have the potential to affect any pregnant women, and that can be wrongfully enforced in countries like Rwanda and El Salvador. As I mentioned before, there are cases of women who they have been imprisoned just for having a miscarriage. So this is like something that is very important for the medical community to have in mind, because this also limit their role and their ability to provide healthcare. So the next slide, please. So what happened when a woman is denied a safe legal abortion? What human rights are violated? And as I have mentioned, next please. As I have mentioned in this presentation, um, there are different human rights that are violated, but especially the right to equality and freedom from discrimination, because women who are poor, young, uneducated are more likely to be arrested. Women with resources usually can find services that are more discreet, and that they can pay a provider that is trained, that has the the required training to have a safe abortion. They providers offer them with confidence, or they can travel abroad if necessary, or they can pay someone. They can pay someone if they get arrested. So, for example, in research in Brazil have found that it is like poor women who are being arrested because the condition and the situation where they live, they don't provide the same um, discretion or secrecy that women with more resources can have. And right to dignity, because they are arrested, they go to trial, they had to talk about their personal issues. Everyone in their community learns about this, and there's more stigma that is reproduced and discriminations against these women's. Also, the right to privacy, the right to confidentiality, a right to health. Women, healthcare is made public through trial, arrests, newspaper publishing, or where women are reporting when seeking post-abortion care. And the right to information, so they don't have because of the fear of arrest, um, or because of the chilling effect that exists with these cases of criminalization, women don't look for information, and they don't have access to the information they need to have a safe abortion. The right to be free from cruel, inhumane, and degrading treatment, particularly women that are questioned in the course of obtaining post-abortion care, and women who have been even handcuffed while seeking post-abortion care treatment. And also the rights to benefit of scientific progress. If care is delayed while women are questioned, whether they self-induce or had an illegal abortion, they are not getting the treatment that they need and that they are supposed to receive in a public or private clinic. But obviously, when all this situation happens and there's human rights violation, as I mentioned, it is positive to know that there's a lot of a movement, and also a progressive movement trying to make sure that women are having services, and especially organizations like IFMSA, where there are more trainings and more also interest on learning more about this issue. And so not everything is bad, and I know that this type of like situation examples of what happened when abortion is criminalized, it can be very disencouraging, but at the same time, there's a lot of things that we can do and you can also do. So let's go to the next slide. And it's like there's a lot of evidence on things that what are like the solutions, or what are like the strategies that we should be implementing to promote access to safe and legal abortion, but also to reduce unwanted and unplanned pregnancies. And I just I wanted to use this infograph from Women Deliver from their last conference, where um, some of the solutions that are, that has been not only shared by Women Deliver, but also from other organizations like Ipas and others, is like we need to continue to satisfy the demand for contraception. There's a lot of information on how in most of the countries, especially in developing countries, women don't have, they're not able to decide the number and spacing of the children they have because of different reasons, but also they need more information and access to contraception. We also need to continue to improve access to post-abortion care, where women can have the confidentiality that they need, but also that they are able to go to health services without a fear of being denounced and receiving the treatment that they need. But also continue to work to legalize restricted abortion laws, because we know that by criminalizing abortion laws, we are not reducing the number of abortion, we are just making it unsafe. But one very important thing is to address abortion stigma, and I think that IFMSA is doing a great job with that by promoting different trainings and spaces for students and for the communities where you work to have this type of conversations and learning more about the issue, and addressing like where are these beliefs or these conceptions that we have about abortion are coming from, and how they just limit like women rights and their opportunities. But something also very important is to provide comprehensive sexuality education, and I know also organizations like IFMSA, they're doing a good job on that. But making sure that also comprehensive sexual education programs include information about abortion, and that they don't promote abortion stigma, but they what they do is like they provide information of women on how to prevent an unplanned pregnancy, how to link to services in their communities, how to being able to access to contraception and access to safe abortion services. And but there's also, I wanted to provide in this presentation some examples of things that you can do also from your own national association or from your position in IFMSA. And it's like continue learning about this issue. There are different opportunities through national assemblies and regional meetings or general assemblies, where there are different students leading peer education on abortion. So these are very important opportunities to have discussion with your peers about abortion, and how from your own NMO you can also do more work on this issue. But there's also a lot of resources that are available. I know that SCORE recently put together a database, I think it's called, with different resources that you can go and learn more about it. And as partners of IFMSA, we're always open to provide more informations and opportunities to do this. Um, some of you may have seen or you have been involved in some of the social media campaigns that they were um, implemented last week, and this is a great way to reduce stigma and share information about safe abortion, because by talking about this issue, we highlight the importance of it, and also we normalize it, and stop like the silence that sometimes exists when addressing this issue. But also an important issue is that the policy that IFMSA has on is maternal health and safe abortion promotes the advocacy for the inclusion of safe abortion in the medical curricula. And it is important to see as a student and leaders in IFMSA what are like the opportunities that you have to influence or to have these conversations in your university or in your school to advocate for this issue, because it is an important part of like the medical student training. And the last idea that I have is like that we can also, conduct sensitization interventions in your university or your community. I know a lot of you also have outreach activities at the community level, and this is always something important, especially for you as medical students. You have a lot of recognition and respect in your community, so it's very important to use that to promote more awareness and information at the community level. And one last slide that I have is just to say thank you, but also IFMSA and Ipas, we have created a tool. I'm sure some of you may have seen it. It is available online, and it is called the Youth Act for Safe Abortion. That is a training guide that has different tools and different activities and information that is evidence based, that about how medical students can do their own trainings, but at the same time they can find more information about this issue. So I'm going to finish here and say thank you. And I don't know, Carlos, if we have questions or.
Hey, so we do not have questions at the moment. However, if you want to like ask any question, please do now. You can also comment on our YouTube channel, or you can send your questions through squareid@ifmsa.org, or as well by joining the live chat right here. So if you have any questions, specific questions like for the presentation that we just saw, then just please let us know, and we'll forward them to Cecilia. And yeah, I think that's basically Cecilia. Thank you so much for joining us today, and thank you so much for your presentation. I think it was awesome, and we're very happy, let's say, to continue this collaboration with Ipas. I guess that this year we had like much more investments in September 28th, and we are very excited to develop new things together.
Thank you, Carlos, and I agree with you. I was very excited of seeing like the different activities that different national associations did, and I think it's as I said, it's very important to continue to learn about this issue, and I invite you to all of you to do that. And as Carlos mentioned, you can send us questions. He will give you the email where to send them, or you can do it online, and I can also respond there in the Scora Facebook group or in the YouTube channel.
Okay, great. So thank you so much for joining. For our viewers, thank you so much for signing in. Please like iPass and IFMSA Facebook pages or Twitter accounts, and we'll see you then in the next opportunity.
Thank you. Bye.
Okay, bye.